Definition: Post-traumatic stress disorder (PTSD) is the physiologic disorder that might occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrible act, were compact or crap, or who has been theorized with death, sexual involvement, or seriously intractability. PTSD can occur in all people of any ethnicity, nationality, or culture, and at any age. People with the PTSD have intense distributing through and the feeling related to their experience that lasts long after a traumatic event has ended. They might relive the event through the flashback or the nightmare. They might feel sadness, fear, or anger that they might feel the attracted or estranged from the other people. Symptom instruction instructive through such as repeating, involuntarily memorize, distressing dream, or flashbacks or traumatic events. Avoidance avoiding is reminder of a traumatic event might including avoiding people, place, activities, objects, and situations that might trigger distressing memories. Interaction is a condition and mood, inability to remember important aspects of the traumatic event, negative thought and the feeling, distorted thought about the cause or consequences of the event led to the wrongly planning self or other. Interaction is a cultural and activity. A closely attractive symptom might including being irritable and having angry outbursts, having recklessly or in a self-destructive way, being overly watchful of the other, arousing its expression way, being easily distracted and having problem concentrating or sleeping.
Hi, Bismillah, Assalamualaikum warahmatullahi wabarakatuh. And here I would like to share to you the signs of traumatic stress disorder or PTSD. So as we already know the definition of PTSD by our sister, we know that PTSD may occur due to a sudden death of the loved one. And the symptoms may occur normally within 3 months after the accident, while some other people will show the symptoms years after the accidents. And for the recovery, some people may recover within 6 months, and some other people need longer than that, and some other people may experience their PTSD becomes chronic. So how we can diagnose PTSD? So people who can diagnose PTSD are doctors who are experts in handling mental health patients, such as psychiatrists and psychologists. So to be diagnosed with PTSD, an adult must have all the following for at least 1 month. So first, at least 3 experiencing symptoms. Second, at least 1 avoidance symptoms. Third, at least 2 arousal and reactivity symptoms. And the last one, at least 2 cognition and mood symptoms. So we cannot personally diagnose ourselves if we have PTSD without the confirmation of psychiatrists or psychologists.
Hi, Assalamualaikum. And next, I will explain about how patients with PTSD can get a treatment. So first of all, PTSD patient can try to talk to the doctor about the symptoms that they get and any other option of treatment they can get to help them. They also can engage in physical activities such as do some light exercise because it will help reduce the stress, and don't forget to set realistic goals for them to achieve, because if they have goals to achieve, it will make them switch their focus on achieving the goals that they want. Next, break up big tasks into small tasks. Set some priorities and have to make sure do what tasks that they think they can do without any pressure. Lastly, try to spend some time talking with the trusted friends or relatives. Tell others your worries that might be causing the symptoms, and it will help the patient to relieve some of their worries. Next is the factor that increase the risk for PTSD. Based in the study stated that women are likely to develop PTSD rather than men. And due to genes, people are more likely to develop PTSD rather than other people. So the first factor that increase the risk for PTSD is people who live through dangerous events and traumas. The one who getting hurt also can be one of the factor because they might hold their pain and don't want to show it to others. Seeing another person hurt or being tortured also can lead to PTSD because they cannot handle the trauma that they get or witness what happened. Childhood trauma also one of the factors where the people face such a bad injuries or tragedy at young age and then lead the trauma that they cannot forget. Having no one and no social support after the bad events also can be one of the major factors because it can lead the patient to do anything with their insane mind and no one can remind them what action should and should not they do. Lastly, having history of mental illnesses also dangerous, for example like substance abuse, dealing with extra stress after the events such as loss of a loved one, pain and injury, or loss a job or home. This factor can lead to increase the risk for PTSD. And yeah, that's all from our group. Thank you.